palliative care means end of life, means possibly hospice, but ultimately when you start talking palliative care, you feel like you're accepting death. And that's a part of the process that can take people a long time to get to. And it's certainly not a necessary part of the process at the beginning of a dementia diagnosis. So palliative care, I was surprised to learn, is not the same as end of life care. So palliative care is a process of managing symptoms and managing pain when treatment of the illness is no longer a possibility. We're not going to cure whatever you have, but we can make your life with it more comfortable. So one of the experts that I spoke to at a hospital in Vancouver, she directs the palliative care unit out there, and she said, you know, me and my team are constantly selling ourselves and our services to the people who just don't want to talk to us. And she says to me, you know, people are afraid that if we are dispatched to their room, that means there's something that the doctor's not telling us because the palliative care unit is here. And that's not what it means. It means, first of all, we want to make a directed plan for how you or your loved one is going to live out the rest of your life. And when you introduce palliative care, apparently, studies suggest that your life is in fact extended by almost 3 months in some cases with cancer, and in other studies as much as a year. So let's say your mom has dementia and she is starting to become hospitalized more frequently, because that does happen as the disease progresses. There's lots of things that can start to go wrong. But the hospital experience is very difficult for people with dementia. It is not easy for most of us, but when you have dementia, delirium can set in, the environment is brand new. It's a little bit in your face, in the sense that people have to touch you, they have to draw blood, you have to sit in the bed, you have to follow directions. It can be very difficult for people with dementia, so they can become delirious and unsettled. And you can imagine if that is something that ends up having to happen every month because you have started having aspirational pneumonia, which is one of the markers of the final stages of dementia, that the swallowing mechanism becomes compromised and you regularly are having food or water or saliva go down the wrong way, which can cause infection, and you often end up in hospital. So do you want to keep going to the hospital and treating the infection and then having it come back and going to hospital? These are the questions that palliative care asks, and that the team of doctors and nurses on the palliative care unit will force you as a family to talk about. And so she was saying, this doctor out west was saying, you know, in an ideal world, this is a conversation you've had with your mother years before she ever gets to the hospital. Under what circumstances do you want to continue to have medical treatment? What kind of medical treatment do you not want to consider having? Is intubation okay? Will you take any kind of drugs? Do you want to be fed through a tube? Like, what are your sort of markers and lines in the sand? For most people, what ends up happening is you have those conversations when it's an emergency, when you're already at the hospital, when things are dire, when it's a little bit fraught, because you may not know. I don't know what my mother wanted, and it's a lot of responsibility. I don't want to make that call on my own, and yet she can't. So palliative care teams can come and help you ask the questions that you need to ask of yourself or of your loved one if they're able to contribute in some way, but even if they're not. And so they can also explain to you what the choices are. So this doctor was saying out west, a lot of times people don't realize that you don't have to take all treatment that's being offered to you. You will always be offered pain management, and your comfort is paramount. But if you have some kind of infection, you don't have to take the antibiotics that cure the infection. We're going to or whatever drug it is that's going to deal with the infection, but we will deal with the symptoms of the infection. And as she said, and then we can talk about letting life take its natural course, but that doesn't mean that it's going to happen tomorrow. That doesn't mean that this palliative care conversation is actually accepting that your death is today or next week. It means deciding how the end of your life will eventually go. But in early steps, having conversations and knowing what your options are. And it's one of the more difficult parts of the process. But if people start asking for palliative care earlier, they may find that they have extended time with their loved ones and that their loved ones have more time in comfort. One of the things that I did hear was that while yes, and that's why the aspiration pneumonia was one of the things that the doctor talked a lot about, because it's not unique to dementia, but it's very common to dementia and Alzheimer's. And it usually, if aspiration pneumonia sets in once, it's more likely to happen again. And it is one of the signposts that doctors have, where often they'll say, we have about 6 months to a year now for dementia. Part of the problem is that oftentimes people who have dementia and get to that point, they do have an underlying condition that may end their lives before the dementia has set in, right? I think that they say, you know, heart disease and diabetes and secondary comorbidity factors are much more common with secondary illnesses. I shouldn't have said that. Secondary illnesses are much more common when people have dementia. And so we do forget that dementia itself, that Alzheimer's itself, is shutting down the systems that allow you to live. I think it's such a personal question in the sense that what every caregiver needs in order to feel like they're supported, they're doing the right thing to whatever their concerns are. But I do know that there are a lot of places that are the caregiver is not lost in this conversation about healthcare and about dementia. I think that healthcare workers are acutely aware of the fact that the caregiver is under a lot of stress. By definition, the role is stressful, that the caregiver is fundamentally necessary to the care of the patient, and perhaps more so than any other player in their healthcare. Every healthcare worker that I've spoken to, after they say, yes, we do these tests or we can do that, is like, and so the caregiver, we need to meet the caregiver, we need to talk to the caregiver, we need to relieve the caregiver burden to the extent that we can. So these are the resources that we have to do that. And like I've said, sometimes that can be meditation, sometimes that can be accessing respite care, sometimes that can be accessing financial information, because if you don't know if the money is going to be there, that's very stressful, and then you can't do your caregiver role the way you need to. So there are a lot of services for the caregiver. I wonder if maybe caregivers are so immersed in the business of being a caregiver that they don't have time, or B, feeling like it's not about me, it's about the patient, that they don't go looking for it. Because all of these healthcare workers also said that it's the kind of service where they need to say and encourage the caregiver to accept help, as opposed to them putting up their hands and saying, I need help. That doesn't happen so frequently. I was talking to one woman last month, I guess, and her husband had recently died of Alzheimer's, and she was talking about being in a memory clinic, because she had to go to those appointments too, and her husband would go to the right and she would go to the left, and he would have his cognitive testing and she would sit down with the social worker. And she said, you know, I thought we were doing fine. I thought everything's good. I'm on the waiting list for a long-term care bed for him. I don't know that I want him to go, and that makes me a little sad, but we're good, and I'm cooking and cleaning, and we have our little exchanges, and we watch television during the day. It's all fine. But it was a social worker at the clinic who said, actually, things really aren't fine. You're really worried about Mike, and we can see that, and we're really worried about you. And your health is suffering, and let us help you. And she was like, oh my goodness, I guess I am tired. I guess this is hard. I'm a little sad, right? But it really took someone saying it for her to admit it.